We examined the pivotal trial databases from the trials leading to the registration of Ipilimumab, Nivolumab, Pembrolizumab, or the combination of Ipi-Nivo. And in all these trials, in the reporting, it is mentioned that patients with stage 4 disease were included, and patients with unresectable stage 3 melanoma were also included. And we tried to identify those patients with exclusively satellite or in-transit metastases. So not those patients with unresectable stage 3 disease due to lymph nodal involvement. However, it seemed that this data was not captured within the clinical records form, the CRS of the study. That means that it was a minority of patients with stage 3 disease in these trials. The overwhelming majority of patients had stage 4 metastatic melanoma, and that then within that stage 3 bracket, it is most likely that many, if not all, patients had lymph nodal disease. So very few cases actually are expected to have only satellite or in-transit metastases. So what does that mean? Well, everybody assumes that the response to immunotherapies for patients with exclusively in-transit disease is equal or maybe even better than that of patients with metastatic stage 4 melanoma. But we don't actually have any proof from phase 3 trials to conclude such. At the same time, we do know that there are a number of approved local regional treatments that have a very high chance of a response and a complete response, like, for instance, isolated limb perfusion or isolated limb infusion, TVEC, etc. They have never been examined head-to-head to systemic therapies. So we wouldn't recommend that systemic therapies are better than these local regional therapies. We actually think that we need to have more clinical trials to actually examine the two head-to-head. Probably that's not likely to happen anytime soon, but maybe it's important for you in your clinic to recognize that local regional therapy options can very well be good options for patients with local regional extensive disease. And for the future, we expect a lot from combination studies moving forward in this realm.